All right, let's quick take a look at the mandible, only movable bone of the whole skull. And what we'll notice in the mandible is that you have two little processes that stick out. One process is a little sharper right here, another process that's a little bit duller. Now, the last thing we want to do is have anything sharp as part of our joint. So this region that's more dull is the region that actually goes and forms our the temporomandibular joint. So this region is called the mandibular process, or sometimes called the mandibular condyle, right? The other region over here is where we're gonna see muscles attach. This region up here, this is called the coronoid process of your mandible. In between, you have your mandibular notch connecting these two. This one helps form the joint, your jaw joint, so then your jaw can open and close. The whole piece of bone that sticks out here, this is called the ramus of the mandible. This is called the body of the mandible right here. Now you see a couple openings in the mandible. This one right here is called the mental foramen. And the mental foramen, you can see one on each side right here. The mental foramen, number 22, is where you're gonna have nerves and arteries come out as it supplies nerve and blood supply to the anterior part of your front and lower teeth, right? Now the angle is where the ramus and the mandible and the body meets up, number 21. Again, coronoid process, and this is the mandibular condyle. Only the mandibular condyle, number 20, makes contact with the temporal bone as part of your temporomandibular joint. Now the last thing we see here is an actual opening, a hole right there, number 23. That's called your mandibular foramen. So again, you have two foramens, mandibular 23, mandibular foramen, a mental foramen, 22, right? You have the coronoid process, 19, and you have the mandibular condyle of the mandible right here, number 20.